GE Centricity Practice Solution is a completely integrated clinical and financial management solution that helps your practice take care of the whole patient, from first visit to final reimbursement and every point in between. Centricity Practice Solution combines the power of Centricity Electronic Medical Record with the proven return on investment capabilities of Centricity Practice Management. It is a singular approach to a more efficient, high-quality practice. Scheduling is very quick and easy. The user can select the time slot, which brings up the search criteria window. Search for a patient can be done by a number of different criteria. Users may search for a patient by a portion of the last name, portion of the first name, a string of text within a name, insured ID, date of birth, phone number, social security number, and/or medical record number. Once a patient is selected for scheduling, you will note that the system defaults a lot of information including resource, facility, doctor, and company. All of this information is already in the billing component, eliminating the need to rekey data as well as reducing data entry errors. The appointment template can be linked to the appointment type, automatically selecting the appropriate forms for the clinician to document the visit. After scheduling the appointment, the user does not need to drill down into the appointment. When a user hovers over the appointment, they can get information about the appointment, including phone numbers, appointment status, and notes associated with the appointment. When the patient is checked into the system, it turns the visit blue on the schedule and spins the appropriate clinical document, landing on the desktop to alert whoever sees the patient first that the patient has arrived. Once the visit is complete, charge information is immediately ready to post to the visit. As the user enters the visit, CPT and ICD-9 codes and other charge-related information is automatically entered, eliminating the need for manual entry. When Dr. Winston logs into the electronic medical record, he is able to see information that helps him manage his day. The home page of his desktop is broken down into 3 windows. His schedule on the left, which gives him quick and easy access to patient information. The upper window is internal messaging or information that flows seamlessly within the office, and the bottom window is his task list, items that are pending that he needs to act on. The schedule is an up-to-date view of the scheduling component with instant access to additional information by just hovering over the appointment. This lets Dr. Winston view everything about that appointment, from the appointment type to the appointment note, without needing to drill into any additional areas. The schedule also grants the physician access to the patient record, making it possible for the physician to quickly review the patient's medical information. The flag section is a robust messaging tool for the provider to communicate with his clinical staff. Internal communication flows easily between users, facilitating the workflow process. Dr. Winston reviews a message from his nurse who ran a population report to identify patients who had an elevated LDL and were not taking a statin. Dr. Winston can quickly respond to his nurse to set up an appointment for Mr. Clune to discuss management of his hyperlipidemia. Sending the note back to her task list for her to respond to that message. A patient's electronic record would not be complete without information from other care providers. Whether the information comes from the cath lab, emergency room, radiology department, or somewhere in between, Centricity connects entire care cycles. Images and consults are pulled together in one place, creating efficiencies in the process of accessing patient information. He has received a radiology report for Robert Garcia. Dr. Winston can take a look at Robert Garcia's X-ray. Access to external devices has helped bring information to his fingertips, streamlining his workflow. Reviewing his schedule, Dr. Winston observes that Donald Cabbage is coming into his office for a follow-up of congestive heart failure. Dr. Winston can very simply access a chart directly from the schedule. Reviewing Mr. Cabbage's chart before seeing him, Dr. Winston can look at the summary page. This one screen shows everything about the patient, his problems, his medications, allergies, even a clinical workflow sheet that is pertinent to his medical problems, all accurate and up to date. If he needs to, he can drill in and view a snapshot of his active medications or problems. He can also see a history that's associated to a specific problem. Similarly, for his medications, Dr. Winston can look at his active medications or even a historical view of the medications, including an entire refill history. The flow sheet is of special importance. His flow sheet is perhaps the greatest value for Dr. Winston and his patient. The data points are standard observation terms that store all of the data about the patient over time and allows Dr. Winston to both report on that data and to manage this patient and patient populations equally. Before Dr. Winston goes in to see Mr. Cabbage, he can review today's chart note. He can take a quick look at the documentation that his nurse has done entering today's information. Reviewing the patient's history and vital signs, he can see what the nurse has actually documented. When Dr. Winston is ready to document, it's easy for him to use standard forms or templates, and he can either type, use voice recognition, or use those templates to gather his HPI and other elements. Documenting the patient's physical exam, he can make any changes that he needs. Before Dr. Winston goes in to see Mr. Cabbage, he can review today's chart note. He can take a quick look at the documentation that his nurse has done entering the patient's vital signs and reviewing the patient history. When Dr. Winston is ready to document, it's easy for him to use standard forms that he can either type, use templates, or he can use voice recognition to capture his HPI and other elements. When Dr. Winston is ready to manage this patient, he can quickly document his findings and use this form as his assessment and plan dashboard. It makes it possible for him to manage this patient problem by problem. Disease management tools are available for Dr. Winston to use. Dr. Winston can add an ACE inhibitor to Mr. Cabbage's treatment plan and e-prescribes the medication to his preferred pharmacy. Mr. Cabbage also had a few areas of actinic keratosis that he wished to have treated. Using quick note functionality to compile his care plan, Dr. Winston can quickly document the treatment. Using a single command, he is able to not only add the procedure note, but also include the ICD-9 code and the appropriate codes for services. If applicable, the care plan could have included the medications as part of the treatment. Dr. Winston is done with his visit, and at that point can sign off on his note, which automatically submits today's charges to his Centricity Revenue Cycle Management System. When Dr. Winston has finished, he can go back to his desktop and manage the rest of his patient's care. Once the visit is complete, charge information is immediately ready to post to the visit. As the user enters the visit, CPT and ICD-9 codes and other charge-related information is automatically entered, eliminating manual entry. Billing becomes a review process rather than data entry. Centricity Practice Solution creates a foundation for positive change in your practice. It provides the tools you need to automate routine tasks, set care quality and business performance targets. The result is enhanced efficiency, informed decision-making, and the capacity to deliver the best patient care possible. When you go digital with GE, you can rest assured knowing you're partnered with a capable, financially stable company that shares your vision for healthcare transformation. For more information, visit gehealthcare.com/centricity.